Kay pagpapatuloy po sa yin and yang organs of the body. Okay. Next. Yan, napakaganda ng drawing. So, ito pong drawing, makikita natin yung ano po ng sa human relations, sa human body ng yin and yang yung development stage natin. So, from infancy, makikita natin na maliit pa lang yung maliit yung yang, malaki yung yin. Kasi siyempre yung structural, di ba, ng baby. Hindi pa siya masyadong makagalaw, kailangan ng alalay. So, slow pa yan yung stage na yan. Bata pa, kung i-relate naman natin sa ng plants, patubo pa lang siya. Dadagdag na lang si Doc siguro mamaya. Kung sino pong gustong dumagdag, magtanong, okay lang po. So, yun. Next is adolescence. Yung adolescence naman, nakikita po natin na lumalaki na yung medyo lumaki yung yang. So, pero balance pa rin siya. Balance pa rin po yung niya. Kasi yan yung panahon na yun, nakakatayo na yung, pag nakakatayo na tayo, yung yang mas lumalaki na rin, tumataas na yung energy natin. So, mas pagpapalalim po siguro magdadagdag si Doc mamaya. Tapos yung prime time, yung balance na yung ng yin at saka yang. Yung prime time na yan, siya po yun yung stage na teenager. Andiyan yung panahon na nagiging matured, maayos na po yung mga decision making din. Pati yung mga organs natin, develop na rin. Siya po yan yung ng prime time. So, next is middle age. Pag nagme-middle age naman siguro, ito yung mga age na above 40. Middle age po Doc? Kikita natin na yung yang, mas malaki na siya. Yung yin, mas maliit. Pero balanse pa rin sa ng structure kasi ng katawan niya So, pag ganun po, parang unti-unti na tayong medyo bumabagal dyan Kahit pumataas yung yang, yung yin medyo kasi medyo humihina. Nakukonsume na yung yin, kaya mas maliit siya. Then sa old age natin, mas maliit na yun. Yung chi natin, mas mahina na. Di ba pag matanda na, pag may edad na, mas mahina, mas mabagal. Kaya yung po mas lumiit na yung yung yin. Mas konti na, mas konti. Kahit mataas yung yang kasi yung yung init, mas marami, di ba yung parang karamihan sa matatanda nag-yin deficient na Yun. Siguro, Doc, dagdag na lang po.
I think alam na nila yan no?
Sabagay, kita-kita naman po doon sa ng drawing. Okay. So, yung yin and yung organs of the body, looking at interior, we have both yin and yang organs, also called solid, yung sang, and hollow fu organ. Alam na po natin to yung sang ay yung mga yung heart, di ba yung mga nasa natin, nasa loob ng katawan na covered. Yan, yung heart, yung lungs, yung spleen, siya po yung sang. Tapos yung organ, mamaya po madidiscuss pa sa baba. Yin or solid organs, nourish body with blood, yung mga yin organs natin. Tapos, siya din po yung nagpo-provide ng nutrition, water, air, recirculate and distribute nutrients and fluid. So, yung nagno-nourish spleen, tapos yung nagpo-produce din ng blood at nutrition. Yung kidney naman, siya yung sa water. Siya yung namamahala sa water sa ating katawan. Yung air ay yung ating lungs. They circulate and distribute nutrients and fluids. Pag yang naman or hollow organs are mainly functional organs. Sila yung mga nag-absorb ng nutrients from food consumed, nag-eliminate. So, ang example dyan ay yung ating colon, yung large intestine, yung ating small intestine, tsaka yung bladder. Kasi sila yung nag-eliminate ng mga toxin, fluid, and stools. Enable yin organ to receive pure nutritional energy. Pag yung yin organ, yung mga nutritional energy ang nire-receive niya. Yung hollow organ, siya yung nagtatanggal ng mga hindi kailangan ng katawan. Okay. Yan po. So, yung yin, ito yung solid organs. heart, lung, liver, kidney, spleen, and pericardium. So yung mga coupled organs niya, siyempre yung heart, small intestine, si lung, ay large intestine, si liver, gallbladder, si kidney, urinary bladder, si spleen, stomach, pericardium ay si triple warmer. So, ganun na nahati. Okay. Napakalinaw naman na po sa drawing, ano. Summarize lang yan ng mga pinag-aralan na natin ng mga nakaraan. So, yung sung and four organs, ang element niya ay wood. Open ang sense niya ay yung eyes na mamahala sa mata. Manifest into the nail. Nakikita natin yung tissue, yung muscle and tendon. Emotion, syempre yung anger. So, si liver ang nagme-maintain ng potency of chi. Siya yung nag-store ng blood at maintain the chi flow. Si heart naman, fire, elements niya. Sense niya ay tongue. Manifest in the face. Tissue niya ay blood vessels. Tapos ang emotion niya ay happy. Siya yung dominate the vessels, blood circulation, and house the mind. Tapos si stomach, govern digestion, absorb nutrients, and produce chi and blood. Ayan yung mga drawing natin. Third, si stomach, ang sense niya ay yung ating mouth, tissue, yung ating muscle. Tapos ang emotion niya ay, ano pong emotion ng ng stomach? Sino pong nakalala? Sino pong nakalala ng emotion ng stomach? Ayan sa drawing.
Tensiveness.
Okay. Next is kidney. So yung kidney, lungs pa lang pala. Ay tama, nasaan ako? Lungs. Lungs control chi, respiration and distribution of blood and body fluids. So ang element niya ay, ano pong element ang lungs?
Metal.
Okay. So ang sense niya ay, external niya ay yung nose. Yan. Tapos manifest. Saan po siya nagmamanifest?
Sa skin.
Ang tissue niya? Tissue? Metal? Sige po, sino nakaalala? Metal po, metal. Tissue. Skin po ang, napagbaliktad mo yata te. Skin ang metal. Skin yun. Tapos, ano pong emotion?
Grief.
Grief.
Or
Okay, next. Opo. So, next is, ano po yan? Anong ka-drawing yan? Anong tingin nyo dyan?
Kidneys.
Opo. So, ano pong element ang kidney?
Water.
Sense niya ay? Opens
Ears.
into the ears. Opo. Manifest in?
The hair.
Hair sa ulo. Ano
Opo.
pang yung tissue?
Bones.
Okay. Emotion?
Fear.
Fear. So, siya po yung nag-store ng essence, yung mga mana nating enerhiya. Tapos siya din yung nagko-control ng reproduction. Siya din yung nagre-receive ng chi, produce marrow and blood. Yan po yung mga summary ng function ng mga organs natin. Kaya napakaganda po nitong drawing. Pwede po nating i-print at i-laminate. Okay. The 5 elements of TCM connecting the function of human organs. So magkakaugnay po lahat lahat ng organ natin ay magkakaugnay ganoon din sa mga gawain. So si metal at saka si lungs, si metal ang under niya ng lungs and colon yung kanyang sangpo organs. So pangunahin na niya sa skin. Nagmamahala sa ating skin. Tapos si earth, stomach and spleen. So digestive system. Si fire, heart, pericardium, and small intestine. Siya yung namamahala sa ating nervous system. Si water, kidney, bladder. Siya yung namamahala sa ating bones and endocrine system. Ano ba yung endocrine system? Siya yung namamahala sa growth natin, yung mga paglaki kasi kay kidney, andun po nakaimbak yung ating mga manang enerhiya o yung king essence. Then si liver ay si wood, liver, and gallbladder. So lahat po yan, nagtutulungan sa gawain at kung nagkakaroon sila ng problema, ay naapektuhan ng bawat isa. So dapat balanse para healthy. Okay po. Next po. So, the 5 elements, ayun po ulitin natin, yung liver, siya ay wood, spring, gallbladder, wind, green. Summary lang po ito So si heart, element siya ay fire, summer, small intestine, heat, red. Si spleen, element siya ay earth, climate niya ay late summer, stomach, damp, yellow. Si lungs naman, metal, autumn, large intestine, dry, white. Si kidney, water, winter, urinary bladder, cold, and black. So, yun. Mahalaga pong tinatandaan natin yan sa ating pagdadiagnose. Ito po, mas magandang summary. Kung wala pa po tayo nito, i-screenshot po natin at pwede pong i-laminate. Yan. Isa-isa yung pa po ba nating basahin para ma-review. Okay, si liver, okay. Wag na screenshot na lang po. Malinaw naman na po dyan yung mga drawings, di ba? Summary nung lahat. Kaya pag nagda-diagnose tayo, yan. Lagi po nating, maganda kung nasa sa ulo din yan Kasi pag nakita po natin yan, alam natin kung ano na yung problem. Yan. Halimbawa si gallbladder, alam natin na open into the eyes. So pag may problema sa eyes, si liver gallbladder na ang titingnan natin. Diba? Siya yung namamahala din sa tendons. Kung ang pasyente mo ay hindi happy or sobrang nagagalit, ayun, makikita natin. So yung kanyang climate is spring, tapos prone siya sa wind, cooling, green, sour, east, at yung clock, body clock, nasa baba na rin po. Si heart naman, small intestine yung partner organ niya. Siya ay under fire, tongue, blood vessel, joy, hatred, summer heat, laughing, red, bitter, south. So yung summary din po ni heart yan Si spleen naman, partner organ is si stomach. Siya ay earth, open to the mouth and lips. Siya namamahala sa muscle. Peace, anxiety, yung kanyang emotion. Tapos yung kanyang season is long summer. Environment niya ay dampness. Sound niya ay singing. Color ay yellow. Taste ay sweet. Direction is center. Ay alam natin yung mahihilig sa sweet. Sa matatamis, spleen, stomach, nagkakaproblema. Si lungs naman, ang partner organ ay si large intestine. So metal siya, open into the nose, skin and hair. So ang kanyang emotion ay appreciation and grief. Autumn ang kanyang season, dryness. Tapos ang kanyang sound ay crying. Color white, taste spicy. So ang direction niya ay west. At ang time niya ay 3 to 7 a.m. Kaya pag ganyang oras, gusto na nyong maglinis ng baga, nauubo na tayo. Yan. Tapos nakakaramdam na tayo, napupunta na tayo sa CR kasi maglilinis na siya So sa kidney naman, partner organ niya is si bladder. So siya ay, ang element niya ay water, open into the ears. Siya din ang namamahala sa bone. So ang kanyang emotion ay gratitude and fear. Tapos ang kanyang season, winter. Environment niya ay cold kasi nga water. Sound niya, yung mga deep sighing. Yung mahilig magbuntong hininga. Yon. So ang color is black and blue. Ang taste niya ay salty. Yung mahilig sa maalat, yan, nagkakaroon ng problema sa kidney. So direction is north. 7 p.m. to 3 to 7 p.m. yung oras niya. Okay, next is si liver. Partner organ niya is si gallbladder. So, ang kanyang elements ay wood. Open to the eyes, mamahala sa eyes, tendon. Ang kanyang emotion ay happiness and anger. Sobrang nagagalit, sobrang kang masaya, nagkakaroon ng problema si liver and gallbladder. Ang kanyang season ay spring. Environment ay wind, kaya prone siya sa wind. Yan. Tapos ang kanyang sound ay calling. At ang kanyang color is green. Taste is sour. Kaya sabi natin, pag nakakaramdam ka ng nakakalasa ka ng maasim, Pag maghapon na maasim, liver, may problema, liver gallbladder. Direction is east. So 11 to 3 a.m. dapat tulog tayo dahil siya ay nag-iimbak ng dugo. Okay po. Next po. Ayan, review tayo uli. Halos yun din yung kanina, no? Yung mga na-discuss na sa atin ni Dr. Gabino. So yung mula sa alas 3 ng umaga hanggang alas 7 ng umaga ay lung and large intestine time ito. Yan. Papangsyon siya sa metal po yun. Tapos, pupunta sa earth, 7 ng umaga hanggang 11, stomach and spleen. Tapos, from 11 to 3, from 11 a.m. to 3 p.m., si heart naman at si small intestine. Time niya yan. Tapos, 3 p.m. to 7 p.m., si bladder at saka si kidney. Then, after ng 7 p.m. to 11, si pericardium at triple Werner. Tapos 11 p.m. to 3 is si gallbladder at liver. Minsan po, para madali po natin matandaan yan, basta tandaan natin na pagising natin, di ba mag-inhale-exhale ka muna, then makakaramdam ka na ng pagdumi. So alam mo pag nag-inhale-exhale ka si lungs, pag nagdudumi ka, si large intestine. Then magugutom ka na, kaya mararamdaman mo na si stomach, spleen. Minsan pag kumain ka, antukin ka rin si heart at saka si small intestine din. Pero minsan makakaramdam ka pa rin uli ng gusto mong magbawas after na kumain, di ba? Yun. Tapos nakakaramdam ka na ng pag-ihi kasi si kidney at saka si bladder na yun. Then si pericardium and triple Werner. So pabalik-balik lang po yan. Kaya kung nakakaramdam po tayo ng mga pag-excrete, wag po yung pigilin kasi panahon talaga yung ilabas. So kung pipigilin po natin, hindi siya makakalabas. So yung function po ng organ na dapat excrete siya, hindi na niya magagawa. Ngayon, pag nanghina siya, maabsorb uli ng katawan mo, dapat ilabas. Minsan po talaga nakakaramdam tayo ng sakit ng tiyan o sakit ng ng puson kasi pinipigilan yung mga dapat na ilabas. Okay po? So there are 12 main organs in the body and the others come under this umbrella group of organs. Example, kidney is related to nervous system and bones. Therefore, kidney governs the brain. Kasi dahil nga dun sa nervous system siya ang nag-govern. At si urinary bladder naman relates to uterus and prostate gland. Kaya pag may mga problema yan pong uterus at saka prostate. So, kailangan po nating i-treat din si urinary bladder at si kidney. So 6 yin organs are paired with 6 yang organs, a 6 couple. Coupled organ have anterior and exterior relationship. Always diagnosed and treated together as one unit. So lagi po natin titingnan yung mga coupled organs niya, yung partner niya. So pag ginamot mo halimbawa si spleen, tingnan mo rin si stomach. Actually, pwede mong gamot, pag may problema si stomach, gamitin mo yung points na spleen. Pwede rin po yun. So yun po yung sinasabi dyan. So lungs are associated with nose and skin according to TCM. So sa traditional medicine, extension of the lungs is our nose. Kaya alam natin kung may problema tayo sa, halimbawa yung lagi kang sinisipon, syempre talaga mo yan yung lungs mo may problema. Laging may problema kang skin disease, si lungs mo may problema, mahina. Okay. Many allergic rhinitis patients have irritable bowel or ulcerative colitis. Others suffering with symptoms in black nose or recurrent nasal polyps are rather constipated. In such cases, treatment of one organ alone often cures both problem. So kung pag tinusukan mo si lungs, pwede mo na rin matreat yung problema ni large intestine. Ganun din si large intestine, pag natusukan mo siya, halimbawa nagtusok ka ng colon 4 or colon 11, large intestine 5, actually, napapalakas mo na rin si lungs. Pwede rin niyang matulungan na mawala yung allergic rhinitis. Kasi partner organ po sila. Okay po, thank you. May tanong po, may dagdag? Wala po. Salamat po.
Thank you very much, Ma'am Mildred. We will now proceed to tongue diagnosis. And let's welcome back Ma'am Teresita Sumile from Zamboanga. Good afternoon po, Ma'am Teresita.
Good afternoon po, Dr. Hector, and happy birthday.
Happy birthday, Dr. Hector.
I thank you po. Thank you.
Okay, welcome to tongue diagnosis. At Nasa greasy tongue coating pa rin tayo, part 2. Our first patient this afternoon is a female, 29 years old. Tongue description: reddish, swollen, red points at the tip, vertical crack with greasy yellow coating, greasy thick yellow coating in the posterior third. Symptoms: stomach pain when excited, burning sensation with urination, yellow vaginal discharge, burning sensation in the vagina, and pain during intercourse. Western diagnosis: chronic urealyticum infection of the urogenital tract. Sorry po. Background to disease: irregular eating habits, long-standing unhappy marriage, and sexual problems. Chinese diagnosis: we have retention of damp hits in the liver and gallbladder, hits in the heart blood, accumulation of phlegm hits in the stomach, and accumulation of damp hits in the lower burner. Now let's go to analysis. Retention of damp hits in the liver and gallbladder is manifested in a reddish tongue body color, particularly on the sides of the tongue, with swollen tongue body shape. That resulted from long-standing unhappy marriage and sexual problems, leading to symptoms of yellow vaginal discharge and pain during intercourse. Okay? Hits in the heart blood is presented with red points at the tip. Accumulation of phlegm hits in the stomach is manifested in a vertical crack with greasy yellow coating in the central area of the tongue caused by irregular eating habits, leading to symptom of stomach pain when excited. Okay? Then accumulation of damp hits in the lower burner is manifested in a greasy thick yellow coating in the posterior third. Patient presented symptoms of burning sensation with urination and burning sensation in the vagina. Now let's go to the case history of the patient for more understanding and clarification. For over 2 years, this 29-year-old banker suffered from a burning sensation when she urinated, a small vaginal discharge, and pain during intercourse. Laboratory findings showed that both she and her husband had a chronic urogenital infection caused by the bacterium ureaplasma. The infection had been treated over the years by conventional methods, but it never cleared up for any length of time. The patient was unhappy in her marriage and constantly wondered whether she should divorce. The tongue coating was very greasy, thick, and yellow in the posterior third. Her pulse was wiry and excessive. Analysis. The symptoms indicate a pattern of excess caused by an accumulation of damp heat in the lower burner. This is manifested on the tongue as a thick, greasy yellow coating in the posterior third. The excessive pulse also confirms this finding of excess. The tongue body is slightly swollen and shows some teeth marks, which suggests an underlying spleen Qi deficiency with accumulation of dampness. Despite this, the slight redness of the tongue body and the yellow thick coating must also be taken into account when formulating a diagnosis and treatment strategy. These two aspects point to the presence of damp hits, especially in the liver and gallbladder channels. The patient's long-standing emotional problems caused liver Qi constraint, which is confirmed by the wiry pulse and led to the development of heat in the liver. The heat has combined with the underlying dampness to form damp heats. This excess in the liver and gallbladder has impaired the free flow of G in the girdle vessel. As a result, the binding function of this vessel has been impaired, as reflected in the yellow vaginal discharge. The red points at the tip of the tongue reflect the formation of heats in the heart, which was caused by the patient's obsessive thinking and emotional strain. Because of the interior-exterior relationship between the heart and the small intestine channels, the heat was transferred to the small intestine channel. This is reflected in the disruption and the secretion of body fluids and the burning sensation during urination. The gynecological examination undertaken because of her pain during intercourse produced no findings. However, from the Chinese medical point of view, this was clearly the result of liver qi constraint. Okay? Now, a greasy, thick, and yellow coating reflects the condition of excess. Often, it occurs with acute symptoms. Even if underlying spleen qi deficiency is at the root of the dampness, a tonifying strategy would be inappropriate. Initially, the heat must be cleared and the dampness will be dried. The patient should also abstain from alcohol, fatty, spicy foods, and dairy products to support the treatment. Okay? Now let's go to our next patient, female, 37 years old. Tongue description: pale red, swollen, red tip, greasy yellow coating from the center to the posterior third. Symptoms are distension and pain in the breasts preceding menstruation, painful menstruation, irritability, fits of rage, or a sudden outburst of anger. Then lack of appetite, flatulence, and constipation. Western diagnosis is fibroadenoma and cyst in the right breast. Background to disease: repressed anger, irregular eating habits, nicotine and cannabis abuse. Chinese diagnosis: spleen qi deficiency, accumulation of dampness, heats in the heart, accumulation of damp heats in the liver and gallbladder. Analysis: spleen qi deficiency with accumulation of dampness is presented in a pale red tongue body color with swollen tongue body shape. Patient in this case showed symptom of lack of appetite resulted from irregular eating habits. Then heats in the heart is manifested in a red tip of the tongue. Accumulation of damp heats in the liver and gallbladder is manifested in a greasy yellow coating from the center of the tongue to the posterior third. Patient in this case showed symptoms of distension and pain in the breast preceding menstruation, painful menstruation, irritability, fits of rage, or sudden bursts of anger, and flatulence and constipation resulted from repressed anger, nicotine, and cannabis abuse. For those who are not familiar with the cannabis, it is a psychoactive dried flower buds, leaves, or preparations or chemicals that are derived from cannabis plants, especially marijuana, so prohibited herbs. Okay, so now let's go to case number 3. Tongue description: pale red with curled up edges, greasy, thick yellow coating, and has old thin coating in the center of the tongue. Symptoms are severe burning pain in the left waist area and chest, exhaustion, lack of appetite, severe dryness of the mouth, and rapid weight loss. Western diagnosis aids in post-therapeutic neuralgia and background to disease, viral activity, inability to eat. Chinese diagnosis, we have liver cheese constraint, accumulation of damp heats in the liver and gallbladder, stomachache and fluid deficiency. Analysis. Liver cheese constraint is manifested in a pale red tongue body color with curled up edges. Accumulation of damp heats in the liver and gallbladder is manifested in a greasy, thick yellow coating with symptom of severe burning pain in the left waist area and chest resulted from a viral activity. Then, stomachache and fluid deficiency is presented in an old thin coating in the center of the tongue. In this case, patient presented symptoms of exhaustion, lack of appetite, severe dryness of the mouth, and rapid weight loss resulted from inability to eat. Yun lang po. Thank you so much for listening.
Thank you very much, Ma'am Teresita. Any questions? If there are no questions, we will continue with diagnosis by interrogation featuring the limbs. Okay, our topics: pain and edema of the feet, pain and burning sensation in the soles, and feeling of heaviness of the limbs. So pag sinabi natin pain in the feet, it is a localized pain. Unilateral, na walang swelling or redness. So this is different from the pain in the joints due to invasion of wind, cold, or dampness, causing the very popular POS, painful obstruction syndrome, or P syndrome. Pain in the foot may occur on the dorsum, the sides, or the soles. Three most common causes are kidney deficiency of yin or yang, blood deficiency, dampness or phlegm. When the pain extends from the side of the foot towards the sole, this is kidney deficiency. If due to kidney deficiency, medyo mainit po, may feeling of heat of the soles. A pain in the ball of the foot, which is aggravated by walking, if the patient is overweight, is due to damp phlegm. So, pag cold, there is severe pain. Pag ang pain niya is due to cold. Pag the pain in the feet is due to dampness, may pain po sa swelling, no? Pag dampness, may swelling talaga yan. Damp heat naman, if the pain in the feet is due to damp heat, there is pain, swelling, and redness and heat. Pag the pain is due to blood deficiency, there is chronic pain and tingling. Phlegm, pain in the feet due to phlegm, there is pain, numbness, and tingling. If the pain in the feet is due to kidney yang deficiency, there is pain and weakness. Pag due to kidney yang deficiency naman, the pain is worse at night, feeling of heat in the soles. Let's go now to edema of the feet. This is due to kidney yang deficiency. So the edema is pitting. No? If the edema is not pitting, it is due to qi stagnation. So let's differentiate the three distinct areas of the sole. The ball of the foot, it pertains to the stomach channel. The area under the big toe is liver and spleen channels. The rest of the sole proper pertains to the kidney channel. Therefore, if you have pain in the ball of the foot, this is due to stomach qi deficiency with invasion of dampness in the limbs or stomach heat. And pain below the big toe is due to liver fire or dampness in the spleen. Pag pain naman in the sole proper, this is due to kidney deficiency, yin or yang, also with invasion of dampness. So I hope we are very familiar now with the diagnosis, no? Pag meron po tayong pain in the sole, no? So yeah, liver and spleen, stomach, kidneys. So you would know what to do. Burning sensation in the soles. This may be due to full heat of the liver or stomach. Pag sa liver, only the area under the big toe will feel hot. Pag nasa stomach, ang heat. So there would be yung ball of the foot will feel hot kasi yung ang stomach area. The most common cause of burning sensation in the soles proper is kidney yin deficiency with empty heat. So in such a case, the burning sensation is worse in the evening and at night. Okay. Feeling of heaviness of the limbs. Patients quite often spontaneously report sensation of heaviness of the limbs. Okay, so yung ang sasabihin ng patient is that their legs feel like lead, mabigat. So a feeling of heaviness of the limbs is more frequently experienced in the legs. Okay, a feeling of heaviness of the legs is always due to dampness in the lower burner. Dampness may be combined with heat or cold, so pwede siyang full or empty. The feeling of heaviness from full dampness is more pronounced than that from dampness associated with spleen qi deficiency. When the spleen qi deficiency is associated with stomach qi deficiency, ang feeling of heaviness is experienced in all four limbs, hindi lang po sa legs, no? When the phlegm causes a feeling of heaviness, it is experienced in all four limbs. Now let's go to cramps in the calves. I think you're very familiar with this. Maraming nakaka-relate dito. Anyone? Okay. The most common cause of cramps in the calves is liver blood deficiency. This is more common in the elderly. So sa gabi po ito usually nangyayari. If the cramps are very severe, accompanied by numbness of the legs, this is empty wind stemming from liver blood deficiency. Cramps in the calves also may be caused by combination of wind and phlegm in the limbs, which occurs only in patients over 70. Pag yung cramps sa calves are accompanied by pain, they indicate that aside from liver blood deficiency, meron pong liver blood stasis. Now, lastly, we go to muscle ache in the limbs. This is nearly always due to retention of dampness in the space between the skin and muscles. Pwedeng full, pwedeng empty. Pag empty, this is spleen qi deficiency. Dampness may or may not be combined with heat. If it is combined with heat, mas intense po ang ache. So aside from the ache, there is pronounced feeling of heaviness of the limbs. In a few cases, muscle ache in the limbs may be due to liver blood deficiency, in which case, mild lang po siya and there is tingling. Muscle ache in the limbs is a common symptom in post-viral fatigue syndrome. Thank you very much. Do we have any questions? So, kay relate na?
Hello, Doc. May ano po ako, Doc, sa ano yung sa sole.
Okay.
Pag tinapak, Doc, mas parang nahihil. Pag inangat yung paa, mas kumikirot. Pero sa stomach and liver and spleen po yung pain. Ibig sabihin, deficient po or yung stagnation, may stagnation. Kasi pag tinapak, nawawala yung pain. Pag inangat na yung paa, may pain.
Depende po sa bigat yan eh. No? Karamihan kasi na yan, may mga dampness.
Payat po ito.
So ano bang nangyari? Na pag umaangat, nawawala yung pain?
Hindi po, may pain pag umaangat. Pag tinapak niya, nawawala. Pero may problem po ito sa stomach talaga.
Oo, pag yung pasyente kasi mabigat, talagang na-aggravate yun. Siyempre pag aangat ka, hindi ka naman umaangat na yung ano lang, yung the rest of the soul lang is affected. Pag aangat ka, nagtitiptoe ka. So as you can see, it's stomach, liver, and spleen. So if you're heavy, lalo na pag malaki yung tiyan mo, so there is definitely dampness, which is very, I think it's common sense.
Parang gravity ba? Po?
Ang ano lang kasi, most of these people, if you're going to be very observant, they're heavy na eh. No? Of course, the pull of gravity. And as much as possible, ayaw mong maapektuhan ng gravity. Eh, diba? So pag nakatiptoe ka, and this is very common amongst those who wanted to learn ballet, no? Tapos mabigat ka. So importante talaga, hindi ka mabigat.
Balance.
Yes. Kasi when you look at stomach and spleen, these are, these are the culprits. If there is a problem there, you'll have a lot of dampness. No? Diba? Yun lang yan. Feeling of heaviness. So there is not only heaviness, there will be pain. So you can do balancing, but kung alam na natin itong areas, then it would not be a problem. And also, when we see patients na medyo maedad na, we will be looking at, the kidneys as well. Lalo na pag 50-ish na 60. No? Okay.
Thank you, Doc.
Thank you very much. Next, let's proceed to Paul's diagnosis. Since wala si Sir Tino, we will request the kindness of Ma'am Teresita. Good afternoon.
Ako po daw kay Sir Dino. Nag-ano po kami,
Okay. Sige po.
nagtulungan.
Paul's diagnosis. Ang topic is overflowing pulse. This is interesting.
Apo.
Okay po.
Pag arkilahin mo, mahal.
Okay. Pulse diagnosis, overflowing pulse. Tingnan po natin kung ano itong overflowing pulse na to. So ang overflowing pulse po ay, the overflowing pulse feels large under the finger, very superficial and broad. So its name implies it is over-described as feeling like a river flooding its bank. Ay yung pag hinawakan po natin, nararamdaman agad yan. Kasi malakas eh, parang river flooding daw. Because the pulse goes beyond its natural boundary in all direction. Pakalat, yan, pag pinatong po natin yung ating kamay sa pulsuhan, mararamdaman natin agad. Okay. So yung clinical significance po niya, the overflowing pulse indicates heat. So heat daw po ito. And it is nearly always rapid as well, mabilis. Although the overflowing pulse is full by definition. So pag nilagay mo yung kamay mo sa pulsuhan, mararamdaman nyo na parang pakalat siya, tapos mabilis at puno. Kaya ramdam na ramdam po talaga yun dahil halos nasa ibabaw lang. To interpret clinical significance, we need to distinguish an overflowing pulse with strength from one without strength. Although according to the theory, an overflowing pulse indicate heat by definition. So pag sa theory daw, overflowing pulse ay init. Pero may mga sitwasyon na it may be due to other causes, especially when it is, tingnan natin, may mga situation daw na hindi to heat eh. Next slide po. Next slide do. Ayan. Found in only one position. Some of these are described below. For example, an overflowing quality of the heart pulse may indicate emotional problem. So tingnan natin, pag pinatong natin yung ating kamay, nasa banda-banda ang heart, sa left po siya sa baba ng pulsuhan, doon sa may halos katapat yan ng lung 9 eh, sa may lung 9, malapit po siya. Ipatong po nyo yung kamay nyo doon. So, an overflowing quality of the heart may indicate emotional problem. So kung may problema pala siya, makakaramdam ka ng overflowing pulse sa parte ng heart. So paharap po sa inyo yung kamay ninyo yung palad. Not necessarily manifesting with heat. So kahit wala palang heat, basta may problema, mararamdaman mo tong overflowing quality na to ng pulse. So it is important to check this against the tongue and the inside of the lower eyelids. Kaya pag naramdaman po natin to, tingnan natin ang dila, tiyak makikita natin ang dulo ng dila ay mapula. Tapos yung lower eyelids, yung may buhok sa anang mata natin, makikita rin po natin itong mapula. So yon, nako-confirm siya na merong overflowing pulse at may heat. Okay po. So overflowing with strength. Tingnan naman natin yung strength. The overflowing pulse with strength always indicates full heat. So pag malakas po, naramdaman nyo, pinatong nyo, at malakas talaga siya, full heat. So excess condition, which may affect the liver, heart, lungs, or stomach. So pag ganun daw po yung tatlong organ ay apat na organs, liver, heart, lungs, and stomach. In this case, it is rapid. So mabilis po siya. Full heat. In the course of an acute febrile disease, so pag bago pa lang po yung yung nararamdaman na pumapasok na sakit, mabilis po siya at saka full. The overflowing pulse with strength is seen with heat in the stomach at the chi level. So nasa chi level pa lang po yung heat ng stomach. So nasaan po bang banda pag hahanapin yung ng stomach? Sa malapit po sa Chungguanchi po sa bandang right. Yon, makikita natin. So overflowing quality indicates the heat is overflowing from the main channel into the connecting channel. So from channel to connecting channel po. In such a case, if the pulse is very overflowing and very rapid, it indicates that the heat is close to progressing to nutritive chi or blood level and possible develop of macules. So pag ang na po yung pulse ay nagiging rapid na, ibig sabihin yung heat ay nagpa-progress na siya, aapektuhan na niya yung nutritive chi or yung blood. Tapos pag naapektuhan na po niya, makakakita tayo ng macules. Ano ba yung macules? Ito po yung discolored area of the skin. Makakakita na tayo may discolored. Thus in the course of an acute febrile disease. So yung mga bago lang pong an overflowing quality often indicates that the condition is changing and progressing to the next level. Lumalala na ibig sabihin. So dapat maging aware tayo doon. So yung overflowing pulse quality is frequently felt in individual position only. And in such case, it usually indicates heat. So pag nakaramdam tayo ng overflowing pulse, kung hindi siya emotional, kung wala siyang emotional problem, meron siyang heat. Pero syempre, pag emotional problem, talagang nagkakaroon ng heat yung liver, nagkakaroon ng heat yung heart. Kaya yun ang mararamdaman. So however, its clinical significance in such cases may be slightly different, often indicating severe emotional problem. Yun. For example, if the pulse is overflowing only on the heart position, kanina po yung heart position natin, parap sa inyo yung inyong palad, then itas po ninyo yung sa baba ng inyong pulsuhan, halos katapat po ng sa may heart. Heart nga po yan, sa heart pulse. If the pulse is overflowing on the heart position, it definitely indicates the patient is suffering from severe emotional problem affecting the heart. So, if the pulse is overflowing on the liver position, it indicates that the person is suffering from repressed anger. So, kung nasa liver naman po, sa baba po ng heart, ilagay ninyo yung inyong thumb para maramdaman ninyo kung may overflowing pulse siya. So, repressed anger. Nagpipigil siya ng galit. Yan ang nag-overflowing yung pulse na mararamdaman. Resentments or frustration. So pag may mga frustration, ganun po yung mararamdaman natin sa pulse. If it is overflowing on the lung position, nasa banda yung ating lungs. So sa right pulse po, sa right po ng kamay natin, sa buwan area is lungs. So it indicates that the patient is suffering from long-term unexpressed sadness and grief. Yun, yung mga hindi makamove on, nag-overflowing po yung mararamdaman nating pulse. Yung sobrang matagal ng maraming lungkot sa puso nila, overflowing po yung pulse na mararamdaman. It is important to stress that when the pulse is overflowing only in one position, it may be overflowing only in the relation to the other position. For example, Halimbawa po yung pulse mo ay weak in general and quiet feel. Yan. Minsan po mahirap maramdaman kasi weak. But the pulse of the heart position is stand out as being more superficial. So pag hinawakan mo yung sa my heart parts po niya ng sa tune area, being more superficial and larger than the others, it would therefore interpret this heart pulse as being overflowing. So kahit weak yung iba, pero pag naramdaman mo yung sa heart area ay overflowing, yun, madadiagnose mo po siya na talagang yung heart niya ay mayroong problema. Yung sabi natin either na hit or mayroon siyang mga kinikimkim sa kanyang puso. So it would not be as overflowing as the classic overflowing pulse. So yun po. Napakalaga ng pulse. Kasama po natin yan sa pagdadiagnose ng tongue. Yun, sa patuloy nating pag-aaral, masasanay tayo sa pagpapulse dahil maganda pong pandagdag yan sa ating mga tinitingnan na basis. Maraming salamat po. May tanong po? May dagdag?
Maraming salamat po, Ma'am Mildred. Thank you very
po.
much. Next, we go to differentials. Kidney young and kidney yin deficiency, predominance of kidney yin deficiency. Let's listen again to Ma'am Teresita Sumile. Good afternoon, Ma'am Teresita.
Good afternoon po, Dr. Hector and classmates. Kidney young deficiency. Kidney young and kidney yin deficiency, predominance of kidney yin deficiency. Etiology, emotional strain, fear, shock, anxiety, excessive sexual activity, chronic illness, old age, overwork, and childbirth. Underlying accompanying pathology is kidney Qi deficiency, kidney essence deficiency, liver yin or blood deficiency, spleen Qi deficiency. Signs and symptoms are dizziness, mild tinnitus, vertigo, poor memory, difficulty hearing, night sweating, dry mouth and throat at night, lower back ache, ache in the bones, nocturnal emissions, infertility, premature ejaculation, tiredness, lassitude, depression, slight anxiety, cold feet, abundant pale urine. Then, ang pulse po niya ay floating and empty or weak on both rear positions. Tongue is normal color and cleared. Treatment principle, supplement kidneys and essence, nourish kidney yin, and we have here acupuncture treatment to be, which is highly recommended. Ren 4 supplements kidney yin and essence. Kidney 6 supplements kidney yin. Kidney 9 regulates Qi and alleviates pain. RN 7 benefits lower burner and genitals. Lung 7 opens Ren vessel. Kidney 3 supplements kidney yin and essence. Kidney 10 benefits the kidneys, and spleen 6 supplements yin. Then needle with supplementation. Thank you po.
Thank you very much, Ma'am Teresita. Next, we go to acupuncture patterns and practice, and let's listen to Ma'am Mildred once again. Good evening, Ma'am Mildred ulit. Ma'am Mildred? Hindi, ako na lang. Wala kasi si ano. We will continue with the discussion on strangury. Now, let's talk about strangury with chyluria deficiency syndrome. This time, yung urine is chronic, oily, with mild hesitancy and pain, gradual weight loss, dizziness, fatigue and lower back soreness, pale tongue, greasy coating, thready and weak pulse. So the treatment principle: stabilize the kidney, restrain the essence. So main acupuncture points: bladder 28, bakshu point of the bladder to tonify the original chi, benefit essence, strengthen lumbus and lower limbs, regulate urination and lower jiao. Stomach 28 to regulate the lower jiao chi and resolve constipation. Bladder 22 to regulate sanjiao, resolve dampness, regulate the fluid passageway, and promote urination, benefit original chi, tonify lumbar region and knees. And our favorite, spleen 6, invigorate spleen, liver, and kidney, tonify yin, and harmonize the lower jiao. Bladder 23, bakshu, kidney, to benefit original chi and kidney yin. Stomach 36, to tonify the spleen, support the correct chi, and tonify deficiency. Supporting points, we have kidney 3 and ren 6. Kidney 3, we all know, is the yuan source point of the kidney, to tonify the kidney yin, clear deficient fire, and invigorate the spleen. Ren 6, to support the original chi, tonify kidney, and treat general weakness. Punta naman tayo sa strangury due to overstrain. Chronic intermittent dribblings and urination that worsens with exertion. Lower back soreness, knee weakness, lassitude and fatigue, pale tongue, and a weak pulse. So, treatment principle: strengthen the spleen, tonify the kidney. Main acupuncture points: bladder 28, bakshu ng bladder, to tonify original chi, benefit essence, strengthen lumbus and lower limbs, regulate urination and lower jiao. Stomach 28, to regulate the lower jiao chi and resolve constipation. Bladder 22 is the triple warmer bakshu, to regulate the sanjiao, resolve dampness, regulate the fluid passageway, promote urination, benefit original chi, tonify lumbar region and knees. And our favorite, stomach 36, to tonify the spleen, support the correct chi, and tonify deficiency. Bladder 23, bakshu ng kidney, to benefit original chi and kidney yin. Bladder 24, to tonify kidney and fortify the yang, tonify the lumbar region and lower limbs, regulate blood and chi. Yung kidney 3, yuan source point ng kidney, to tonify kidney yin, clear deficient fire, and invigorate the spleen. Supporting points, we have bladder 20, bakshu ng spleen, to regulate the middle jiao chi, invigorate the spleen, alleviate diarrhea, and stop abdominal pain. Spleen 4, to invigorate spleen, harmonize middle jiao, and regulate chi. The summary. So far, we have covered all the 6. Let's start with heat strangury. So you can see all the points there. Practically pareho po ang points ng yung a little pareho sa heat and stone. So spleen 6, spleen 9, bladder 28, stomach 28, bladder 22, bladder 39, liver 2, sanjiao 5. Okay. Ren 3. So I think you just have to read on this. These are all found in the previous lectures. Okay. So any questions? Okay, if there are no questions, we will now proceed to signs and symptoms. Let's call on Sir Alvin Palabay of Camarines Norte. Good evening, Sir Alvin. Sir Alvin? Can you hear us, Sir Alvin? Okay. Topic natin is nose ache and nose pain. Okay, masakit ang ilong.
Hello, Doc.
Okay, sige.
Hello.
Yes, can you hear us?
Yes, Doc. I can hear you clearly.
Okay. Sige po, go
Anyway.
ahead. Thank you.
Kayo na po ba?
Di kayo na, kayo nandiyan ka na.
Okay, sige. Okay. So, sorry kasi medyo nasa biyahe eh. But anyway, mag-present naman ako. Okay, malinaw po ba? Naririnig?
Malinaw po, malinaw. Thank you.
Okay. So, ang topic po natin ngayon, nose ache. Okay? So, kapag invasion of wind hit, of course, mayroong nose ache, runny nose, aversion to cold, fever, may cough, may sore throat, may stuff or runny nose with yellow discharge, may headache, body ache, slight sweating, slight thirst, swollen tonsils, tongue slightly red on the sides in the chest area or on front part. Ang pulse niya is floating rapid. Okay? So, marami pala itong pattern. So, phlegm heat in the lung. Nose ache, sticky yellow nasal discharge, red nose, barking cough with propose, sticky with propose, and then sticky yellow or green sputum, shortness of breath, wheezing, a feeling of pressure of the chest, feeling of heat, thirst, insomnia, agitation. Ang tongue niya red and swollen, sticky yellow coating kasi na-phlegm, slippery and rapid ang cough. Next slide, please. Okay, pag may lung and spleen deficiency naman, nose ache, watery nasal discharge, decreased sense of smell, sneezing, poor appetite, slight abdominal distension after eating, tiredness, lassitude, spleen, pale complexion, weakness of the limbs, loose stools, slight depression, tendency to obesity, slight shortness of breath, slight cough, weak voice, spontaneous daytime sweating, dislike to speak, propensity to catching cold, dislike of cold, ang tongue niya, of course, pale, empty ang pulse, especially on the right side. Okay, so, invasion of wind, sa nose pain naman. Okay, may nose pain, runny nose, sneezing, aversion to cold, fever, headache, stiff neck, floating pulse, other symptoms and signs depend whether it's wind cold or wind heat. Of course, that's invasion of wind. Lung and stomach heat. Of course, mayroong nose pain, black nose, and nosebleed, red nose, cough, slight breathlessness, feeling of heat, chest ache, flaring of nostrils, thirst, red face, burning epigastric pain, sour regurgitation, nausea, excessive hunger, foul breath, kasi nga lung and stomach heat, red ang tongue with yellow coating, overflowing rapid ang cough. Next slide, please. Kapag may stomach channel dampness naman, of course, nose pain, sticky yellow nasal discharge, facial pain, redness of the nose and forehead, black nose, sticky yellow tongue coating naman siya. Alright? So, lung deficiency with empty heat, medyo mabigat-bigat to. Nose pain, dryness and feeling of heat of the nose, scabs on the nose, red nose, marrow flash, dry cough or with scanty, sticky sputum that may be blood filled, dry mouth and throat at night, weak or hoarse voice, night sweating, tiredness, a feeling of heat or a low grade fever in the evening, 5 pound heat, thin body or thin chest, insomnia, anxiety. Ang tongue niya is red without coating. Okay, floating empty and rapid ang cough. Liver blood spacing, severe nose na to, okay? Nosebleed with dark blood, may assist to the period in women. Dark nosebleed, headache, hypochondria or abdominal pain, painful periods, menstrual, blood dark and clotted. masses in abdomen, purpleness and lips, purple or dark complexion, kasi nga liver blood stasis, purple of course ang tongue, white or serum on top. Next slide. Carcinoma of the nose. Nose pain is tending to the head, nosebleed with the swelling of the nasal mucosa. Okay. So thank you so much. That's all for today. Any questions po?
Okay, thank you very much, Sir Alvin. Ingat ka sa biyahe. Okay, wala na pong questions. We will now proceed to anxiety. Let's listen to Sir Aldrin naman from Pangasinan. Good evening, Sir Aldrin.
Hello po, good evening po Doc Hector, good evening po sa lahat. So continuation pa rin ito ng ating anxiety. So nasa treatment na po tayo. Share screen lang po ako. Okay, so acupuncture treatment to po tayo. So more i-discuss natin ngayon yung mga point combination sa head. Okay, so mga head points. In order to calm the mind and relieve anxiety, it is important to combine distal point with points on. So yung mga points sa head for anxiety na ginagamit nitong author ng book na to, Do 24, Shenting, GB13, Benshin at saka Do 19, Holding. Okay, so actually medyo sounds interesting bago itong mga point na to sa akin. Usually kasi pag calming, ang very familiar tayo na ginagamit, Do 20. Okay, yung sa may bumbunan natin, yung sa may lubog dyan, yung sa may depression dyan. Pero yon hindi niya ginagamit yon itong author natin. So Do 19 naman yung kanyang ginagamit. So ano yung explanation ng mga points na to? Si Do 24 was traditionally indicated for manic depression, anxiety, poor memory, at insomnia. So the most important aspect nitong Do 24, so yung energetic action niya, downward movement. It makes Qi descend and subdue rebellious yang. This is a very important and powerful point to calm the mind. It is frequently combined sa GB13, the benzene, for severe anxiety and fears. Okay? So to calm the mind and nourish the heart in mental emotional problems occurring against a background of deficiency. Kapag deficiency naman yung background nung anxiety, so yun, ikinukombine si Do 24 at saka si Ren 15. Take note of this kapag deficiency. Okay? So an important feature of this point that makes it particularly useful is that it can both calm and lift the mind. Therefore, it is used not only for anxiety and insomnia, but also for depression and sadness. Okay, so syempre, 'di ba kapag depression, okay, sadness, pag malungkot, parang low moral ka, 'di ba? Yung depressed nga, di parang mababa ka, di ba? Mababa yung chi, parang ganun yung itsura niya. Kaya itong point na ito, nakakatulong siya to lift up, to lift the mind. Ganun. Kumbaga kapag malungkot ka or depressed ka, ito naman parang nakakatulong siya to lift, motivate, parang ganun siguro nakakatulong para i-motivate or i-encourage, ganun po, lift up. Okay, so saan ako natigil? It is used in psychiatric practice for schizophrenia and split personality. Pag sinabi nating schizophrenia, ito yung mga may mga hallucination, okay? Either naririnig or nakikita. Ganun po, may mga hallucination. Pero sila lang po yun. Ganon. Yung merong schizophrenia, sila lang po yung may ganong hallucination. Pero hindi naman talaga nakikita nung iba. Di mo, nag-hallucinate na may naririnig. Ganon po. Tapos split personality, definitely, ito siguro, ito yung may mga bipolar, ganyan. So split, ganyan. So, yun, paiba-iba po yung personality nila. Okay, so the name of this point, Shenting, means courtyard, refers to its strong influence on the mind and spirit. So the courtyard was traditionally considered to be very important, and it was the part that gave visitors their first impression of the house. Okay, so parang pag sinabi nating courtyard, parang ito yung parang bukana, di ba? Usually, ito yung kung sa bahay natin, ito yung parang sala or kung hindi man terrace, kung meron tayong terrace, di ba? So meaning, kapag meron tayong visitor, papasok sa bahay natin, kapag maganda yung opening, maganda yung courtyard, 'di ba magkakaroon agad siya ng impression, ay maganda itong labas ng bahay, ay sigurado maganda rin itong loob ng bahay, parang gano'n siya. Okay? So bakit very important yung entrance na 'yon? 'Di ba? So thus this point could be said to be the entrance to the mind and spirit, and it being called a courtyard highlights its important. Okay? So, meaning kung gusto talaga nating makapasok sa mind at saka spirit, ganyan, dahil itong point na to is siya yung courtyard, doon tayo talaga mag-i-start. Ganon, hindi naman po pwedeng pumasok parang mag-over the bintana, parang ganun, mag-shortcut, parang ganun siya. Okay? So, GB13 naman calms the mind or the shen. Okay, and subdue liver yang. It also extinguishes wind, resolve phlegm, gathers essence or the jing. Okay, so ito yung ating minanang chi, di ba, yung ating essence to the head and clears the brain. Its classic indications include manic behavior at saka fright. So itong GB13 is very important point for mental and emotional problems and for anxiety. Important din ito sa mga psychiatric practice for schizophrenia and split personality. Tapos pag kinumbine pa po sa Heart 5, Tongli, and GB38, the Yang Fu. It is also indicated when the person has persistent and unreasonable feelings of jealousy and suspicion. Okay? So, apart from this mental trait, it has a powerful effect in calming the mind and relieving anxiety deriving from constant worry and fixed thoughts. Its effect is enhanced if it is combined with Do24, the Shenting. Okay, so kung papansin niyo halos 3 point lang yung tinuturo na head point, pero yun kinukumbine siya sa ibang mga point, yung mga distal point like Heart 5 kanina, tapos yun may mga combination para yun parang combination ng head at saka ng distal point ganun po siya. So in deep mental and emotional effect, it also due to its action of gathering essence to the head. So the kidney essence is the root of our pre-heaven chi and is the foundation for our mental and emotional life. So a strong essence is the fundamental prerequisite for a clear mind or the shen. Okay, so familiar naman na tayo sa kidney essence or the jing, di ba? So ito yung ating minana sa mga parent natin. Okay? So kapag maganda or anong tawag dito, yung maayos yung ating essence, strong yung ating essence, definitely yung mind natin clear or maayos din, or ano ngalan nito, balance, parang ganun po siya. So this of this point name root of the mind, that is this point gather the essence that is the root of the mind. Okay, so meaning definitely kapag naging deficient yung essence, tapos deficiency yung essence natin, nagre-result ngayon siya ng anxiety. So definitely pag ganun kasi, ang layman's na sinasabi natin, hindi rooted yung mind. Okay? So meaning, alam natin na yung mind nagro-root siya sa essence. So meaning, we need to anong correct term, yung i-gather natin yung essence para mag-root yung mind natin. Okay? So the kidney essence is the source of marrow which fills up the brain, called the sea of marrow. Okay? So GB13 is a point where essence and marrow gather. Okay? So the Great Dictionary of Acupuncture says that this point makes the mind Shen returns to its root. Okay? So the root of the mind is the essence. Hence, this point gathers the essence to the brain and calm the mind and relieves anxiety. Okay, so hopefully hindi kayo naguluhan doon. Basta ang keyword dyan, ang mind, ang root niya ay essence. Okay? So once na hindi rooted si mind sa essence, which is the Jing, so alam naman natin na yung essence na yan nasa kidneys natin, right? So meaning, yun, kailangan na magkaroon ng essence, masupply yung mind or mag-root yung mind natin sa essence. Kasi kapag hindi siya naging rooted doon, magkakaroon ng mga psychological problem or emotional problem like anxiety. Ganun lang po yun. Okay? When combined with other point to nourish essence, such as REN4, to nourish the essence, combine natin si REN4. GB13 attracts essence toward the head. Okay, so which the effect of calming the mind and strengthening clarity of mind, memory, and willpower. Okay? So meaning kapag puncture tayo sa GB13, yung essence, ina-attract niya pupunta sa ulo. Okay? Para maging rooted yung mind natin. So the connection between GB13 and the essence is confirmed by the text An Inquiry into Chinese Acupuncture, which has among the indication of this point excessive menstrual bleeding, impotence, and seminal emissions. So finally, GB13 resolves phlegm in the context of mental emotional disorders or epilepsy, that is to open the mind orifices when these are clouded by phlegm. So ito na yung sinasabi natin na clouded by phlegm, okay? So kapag halimbawa yung heart natin clouded by phlegm, ganon, o yung mind natin clouded by phlegm, di ba magmamanifest po yung mga psychological disorders like manic attack, schizophrenia, anxiety, and so on and so forth. Okay, so meaning, nakakatulong itong GB13 para i-resolve yung phlegm. Kasi lalo na kapag nag-cloud na itong phlegm or bumalot na siya, ganyan. So to clear the phlegm and to free the mind or to free the heart doon sa clouding, we need to resolve the phlegm. Ganun po siya. So the indication of GB13 shows that it's eliminate the three pathogenic factors of wind, fire, and phlegm from the lesser yang, in which cases this point should be reduced. So lastly, si Do19 calms the mind and opens the mind's orifices. Its classic indications include manic behavior, anxiety, mental restlessness, and insomnia. So DO19 has a powerful calming effect on the mind and is very often used in severe anxiety, especially in combination with REN15 or JV. Okay, so yon. Head point DO19, distal point REN15. Okay, so yun lamang po yung topic natin tonight. Thank you po.
Thank you very much, Sir Aldrin. Do we have any questions?
Wala po.
Michael? Wala. Okay. Wala po tayong Zoom mamaya kasi meron pong board meeting yung sa PAI mamaya, 7. So, relax muna tayo. Baka ano kayo. Wala po tayong Zoom. We will resume tomorrow yung Zoom ng 8 p.m. We would like to invite everyone sa balance method system 4. No? So, tonight, wala po muna. Okay? Pahinga muna or aralin niyo muna yung systems 1 to 3. Thank you everyone for joining, and we hope that everybody is calm and relaxed. Stay healthy. Thank you sa lahat ng ating presenters. Good evening, everyone.
Thank you, Doc.
Thank you
Happy
po, Dr.
birthday.
Hector. Happy
Thank
birthday.
you. Thank you very much.
Thank you po.
Maraming
Happy
salamat.
birthday po. End class ko na po.
Thank you po. Thank you.
Classmate.
Thank you. Take care all. Bye-bye.